Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. Welcome. Good morning. We hope you had a great morning and are awake and ready for this nice day. My name is Dr. Lederman from Radiosurgery New York. Radiosurgery New York is a cancer treatment center. It's a private center for you. Of course, we take most insurances, Medicare, Medicaid. Private means we work for you, not the drug companies, not the surgeons. Our responsibilities are for you. You are the boss of your body, not us. We serve you. And that's what makes us so different. So not only do we serve you, not only are you our boss, but we listen to you, and we provide options available, options you may not have known about. Perhaps you've never heard about all the options available, options that have a chance to treat your cancer successfully. So each case is different, each person's different, and it's obviously best for each person to come in, make an appointment, come in and spend an hour or two, let us go through all the documents, examine the patient, and know what's going on. You can't do that, unfortunately, with a little phone call. It doesn't work that way. Often patients don't even have the documents. Other doctors haven't given them the documents which we will give you. We'll give you the documents about your pathology, your scans, your images, so you'll have everything that you can go home and read as well. So that's what we mean by serving you. You're the boss, we work for you. So we often talk about this show providing information to live better, to live longer, to make better decisions. And I want to talk about an article which you may have not seen. Actually, it was published in the New York Times this week, an article by Gretchen Reynolds on the 30th. She writes, and this is her introduction, running for as little as 5 minutes a day could significantly lower a person's risk of dying prematurely, according to a large-scale study of exercise and mortality. These findings suggest that the benefits of even small amounts of exercise may be much greater than experts had assumed. Now, in recent years, brisk walking had been the focus of exercise science, but there was a government study in 2008 with guidelines that suggested people should engage in 30 minutes of moderate exercise most days of the week, and as an afterthought, they said that 15 minutes a day of vigorous exercise should be equally beneficial. So that's what we knew up till 6 years ago, but there's a new study that was published in the Journal of the American College of Cardiology from Iowa State, which is, of course, close to me. I'm from Iowa, and several other universities, University of South Carolina, Baton Rouge, Cooper Clinic in Dallas. And for decades, researchers have been collecting information from tens of thousands of people going to clinics. And these people filled out forms, and from these forms there were 55,000 healthy men and women aged 18 to 100 who had been to the clinic at least 15 years before the study started. So a lot of patients, 55,000, followed for a long time, at least 15 years. And of this, 24% identified themselves as runners, and the pace and the mileage varied. So they looked at the death records, and in the 15 years, about 3,500 of the 55,000 had died, many from heart disease. But the runners were less susceptible than non-runners to dying. Runners' risk of dying from any cause was 30% less than non-runners, and runners' risk of dying from heart disease was 45% less than non-runners. Wow. And this was true even for people who were overweight or who were smokers. The author notes that not many runners smoked, and even overweight smokers who ran were less likely to die prematurely than people who did not run, regardless of their weight or smoking. So, how much time do you gain by running? How much longer do you live? Take a guess. Yes, it's 3 years. So people who run live 3 years longer than people who don't run. The benefits were about the same no matter how much people ran. Now, some people ran for 150 minutes a week and were speedy, but they didn't run. Those who ran 150 minutes didn't live longer than those who ran the least, running as little as 5 or 10 minutes a day at the leisurely pace of 10 minutes a mile or slower. So most people, the authors wrote, can fit in 5 minutes a day of running, no matter how busy you are, and the benefits of mortality, living 3 years longer, are remarkable. So maybe something you want to think about. If you can fit in 5 minutes of running a day, it buys you 3 years of life. Wow. Wow, oh wow. Now, we like to talk a lot about cancer because Radiosurgery New York is a cancer treatment center, and we had a man who came in this week who was interesting, and his care, I think, shocking. So this is a man who came in, 81 years old, a widow. He has a daughter in Maryland. She's up in New York this weekend. He had kidney cancer in 1995. He went to a big cancer hospital nearby, and they removed his kidney, which you may think, okay, that seems normal. Then the next year, he had prostate cancer, and he had radiation there. Even though it was high risk, he had 8.5 weeks of radiation there. In 2007, now remember, he'd removed one kidney, or he had one kidney removed, or let's say a kidney was removed. Now in 2007, he had a kidney cancer in the opposite kidney. Now what did he do then? Okay, now in 1995, they removed the whole kidney. In 2007, they removed half the kidney. And until last year, he'd been doing okay. And then, well, not really okay. The prostate cancer came back, okay? So now you get the picture. He had kidney cancer. The kidney cancer came back. He had prostate cancer. The prostate cancer came back. They cut out one kidney. Then they cut out half of the other kidney. Then last winter, the kidney cancer spread, so it was stage 4. And they went in and cut out some of the spread kidney cancer. And now they're telling him, actually they knew it last year because I've looked at the images, that the kidney cancer came back in the remaining half of kidney, and they want to cut out the half of kidney, so he has no kidneys left, and he'd have to go on dialysis. Wow. He went to the big cancer hospital. He thought he was, oh, I'm so lucky I'm in the big cancer hospital. It's a big building, and people are walking around with suits and ties, and I'm so lucky. But then he starts thinking about it. They treated a kidney cancer by removing the kidney. Then they removed half of another kidney. Then they removed the metastasis. Then he had prostate cancer, which they gave him radiation, which failed. And now they want to remove his kidney to put him on dialysis, even though the cancer has already traveled, even though by removing the kidney, the half of kidney that's left, they won't cure him. They'll make him miserable by putting him on dialysis. They won't cure him because the cancer has already spread. Once you have stage 4 cancer, removing the remaining half of kidney is not going to cure him. It's going to make him go on dialysis for hours and hours, 3 times a week. He's 81 years old. Right now, his half of kidney is working, and in fact, for almost all of us, a half of one kidney is enough. And I don't advocate removing your kidney, and you'll hear later in the show other patients who come to me with kidney cancer who don't want their kidney removed, and we give radiosurgery, and we have great success. Our success rate where we aimed the beam for kidney cancer is 90%. So this man came last week. We're staging him up. They wanted to remove his kidney half without even staging him up, without even knowing where his cancer is, relying on tests from last October. Wow. So he's coming in tomorrow. He's getting a staging test. That's what he wanted to do. His daughter's come to town from Maryland. And we're going to meet. We're going to go over his tests and show him and his daughter exactly where the cancer is. We're going to talk about using all methods of treatment, not just one. And there are certainly options available so he can keep his kidney and be treated for the cancer. For example, with radiosurgery, which is not surgery, there's no cutting, no bleeding. Our success rate in treating kidney cancer is 90%. And we could have treated the kidney before. We could have treated the half of kidney 5 years ago. We could have treated the liver metastasis. And in fact, if he had come to us for prostate cancer treatment, and we have the data from that big cancer center, it's in our booklet, and you can go exactly to page 8, figure 10. You can see our results for high-risk prostate cancer. Our results are 91% better than the big cancer hospital. So next time you walk in the big cancer hospital, remember, the relationship is between the patient and the doctor, and the patient is the president of the United States, of his body or her body, and the doctor serves the patient. It's not the patient who serves the cancer hospital. It's the doctor who serves the patient. And you have to wonder, are you getting the best treatment? Have you investigated the options? Did you know if you came to us for high-risk prostate cancer, our success rate is 67% for the highest risk, compared to 35% there, a 91% improvement. And had this man come to us, he could have had radiosurgery to the kidney cancer and had kept his kidney. So, what a difference a day makes. He now wants to bring all his medical care to us, which is his choice. We serve the patient. The patient is the boss. The patient is the president of the United States of his or her body. We're going to take a short break. We're going to listen to some voices about work that we do, Radiosurgery New York, a cancer treatment center. We're located at 38th and Broadway, 1384 Broadway. The booklet that I just described to you is available at no charge, along with a DVD. If you just call us at 212-CHOICES, that's our number for the booklet and DVD. Call us during the work week, Monday through Friday, 212-CHOICES, which is 212-246-4237. If you have medical questions, please call anytime, 24/7. We're happy to answer your medical questions. Obviously, the best is to meet in person. So again, this is Dr. Lederman, and we'll be back in just a moment. Thanks.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly